vaginal infection. When the harmful bacteria outnumber the good bacteria in the vagina, the imbalance manifests itself through the physical symptoms of burning. A certain amount of heat is essential to ward off harmful bacteria in the vaginal area. However, overproduction of heat can result in a yeast infection, causing symptoms of frequent burning and inflammatory sensation, without any foul overdraining from the vagina or signs of yeast infection. According to a 2004 study published in the Journal of the American Medical Association, it can also be a reaction to chemicals or ingredients in soaps, creams, contraceptive foams, and prepackaged douching mixtures. These mixtures can alter the bacterial balance and acidity of the vagina to protect it against infection. Vaginal discharge is often the first and most common symptom of this infection. A fishy odor is one of the major symptoms of bacterial vaginosis. According to a 2011 study published in the International Journal of Women's Health, this discharge may especially occur after intercourse. Pregnant women who contract bacterial vaginosis run a risk of delivering their baby prematurely. According to the Center for Disease Control and Prevention, it also increases the risk of contracting sexually transmitted diseases, STDs, including HIV, and may sometimes lead to pelvic inflammatory disease. Therefore, seek medical attention right away if you notice a vaginal odor. Signify a miscarriage. A green or yellow, smelly and froth-like discharge is not normal and may be a sign of trichomoniasis. An STD, a watery white, gray or yellow discharge might be a symptom of bacterial vaginosis, while the amount of discharge differs from woman to woman. Recurrent and excessive discharge may also indicate bacterial vaginosis. Seek medical attention right away if you notice a discoloration in your vaginal discharge. Published in the International Journal of Reproduction, Contraception, and Obstetrics. Gynecologists and women may also notice the passive influence spots through the vagina of menopause, another warning sign of unhealthy vagina and the measure of follicles, birth, and portion of measuring or cervical bleeding during or after intercourse. While it is common for women who are new to sexual intercourse to experience bleeding, medical attention must be sought if it is a recurring issue in young women. Bleeding during or after intercourse in a woman would indicate a vaginal infection, a vaginal tear, produced by childbirth. STDs like chlamydia or vaginal dryness, the friction produced during intercourse can irritate dry skin and cause spotting. If you have gone through menopause and experienced bleeding during or after intercourse, it is a great cause for worry as it could indicate cervical cancer. Therefore, any abnormal bleeding during or after intercourse needs medical attention as it could have long-lasting and great consequences. seek medical attention if you experience painful intercourse at any age.